Hello and welcome to Actually Intelligent. I'm your host, Max Thon, and today I'm joined by Eon Health founder and CEO, Dr. Aki Al-Zubaidi. Dr. Aki, thank you so much for joining me today. How are you doing?
Man, it's a pleasure, man. Thanks for having me. Excited.
Excited to have you here. Well, let's just start with the very basics and kind of set the stage for our listeners. Can you tell me a little bit about yourself and then also Eon Health?
For sure. So I'm an interventional pulmonologist and was really dealing with lung cancer diagnoses early in my career. And so, Eon Health, I didn't start this because I wanted to become a tech founder or because I love code. I was this IP doc at a top institution and I got pissed off. And
Mm,
I had this patient population where I saw triggers like early signs of cancer, Max, and nothing was happening with them and they were falling through the cracks. And I said, I'm not going to let that happen to another patient, if that makes sense.
yeah,
And so at that time, I felt that as a doctor, my impact was micro. And to get to self actualization and how I define happiness, I wanted to make macro impact. And I'll tell you like this funny ass story. Sorry, but like I had this
no,
Armenian guy who I knew, and he would go to the club. I actually like lived it, like trained a little bit of my portion of my life in Las Vegas. He would go to the club and they say, "Hey man, it's a 3 bottle minimum," and he's like, "Minimum? What's the maximum?" And so I approach my life like I don't want to do the minimum. I want to have the maximum impact. And so what I did was that I realized I had to become an entrepreneur to make macro impact. So I dumped my entire life savings into this. I took an at-risk loan. I was emailing like 40 billionaires every Saturday morning until Mark Cuban replied and invested. I would interview 40 developers, paid them 250 bucks out of pocket just to test them. And I built this prototype in my own clinic to solve this problem that I was pissed off about.
yeah. And I mean, you talked about this problem, but just to make it more specific, what was that problem that you were pissed off about?
Yeah.
Um, yeah,
This happens to everybody, Max, and you can probably relate because you've either known somebody or it's happened to you. You go to the hospital, they do a ton of testing. And in that testing, they may find something that's not why you actually came to the hospital. Maybe you got in a motor vehicle accident and they took a bunch of extra like CT scans or x-rays to see if you broke your ribs. But maybe you have this little shadow here. Maybe there's a vessel that's a little enlarged. And then you left. And a year later, nothing ever happened. No follow-up. You didn't get the appropriate follow-up. You didn't know your doctor was buried in their documents. And what happens is that you show up 3 years later and catastrophe, right? The
yeah,
consequences of that are now you have late stage cancer without any like curative options. And that's the problem that we fix.
got it. Well, that's really interesting because I certainly have dealt with that personally. Not really myself, but my father, he had some really bad back issues and would go to the doctor, get these scans. They said, oh, it's a slip disc, et cetera. And then one morning he woke up and wasn't able to move his legs. Well, he ends up going in and found out that there's a massive tumor on his spine that had to be removed. And it was just either the scan wasn't picking it up because they were looking just below it or whatever. But it feels like one of those things where maybe somewhere in the paper trail, they had seen this, but it just never made it into actually being addressed. So
I'm sorry that
I love that.
happened. The
That's
reality is
good.
that 70% of the time when there's a documented abnormality, the
Yeah.
next step doesn't happen appropriately or it doesn't happen at all.
Wow. Yeah. It is. He's fine now, so I appreciate
Good.
it. But it was definitely a challenge. Also, thankfully, uh, what was on his spine was not cancerous, so that was good. But definitely took some while to regain his movement and things like that. Um, So now you did diagnose a patient with like stage 4 cancer who had a finding been found earlier, but was never followed up. What did it feel like when you finally were able to build this solution and were able to actually help people get the treatment that they need?
Man, I tell you, you're talking about Ben, and Ben was 36 years old when he got diagnosed with stage 4 cancer. And, you know, it was the first time in my career where, um, when you're going through medicine, Max, like you're solving problems and you look at it as a case. And there's this like intellectual challenge that gets you through. And then I moved to a smaller community where I got to know Ben. I got to know his family. I got to know other patients. And Saturday we'd go to breakfast and I'd see my patients and their family. And so getting to know people on that truly personal level in the community, that's like the pissed off portion of how I feel, and helpless a little bit. Like, hey, I want to go try to solve this, and I try to solve it within the environment that I'm in, and I'm like, oh, this isn't malicious. Like, people aren't doing this to Ben on purpose. It's because they just don't have the ability to solve this problem at scale. And so, what makes me proud is that every single day we have this channel where we see patient stories of like where we made an impact where it's not going to be Ben. And then we look at, we report out on numbers, and you look at, holy crap, like 500 million patient records have been looked at. And we have 2 million patients per year that we're actually changing it to where 70% don't get the appropriate, where the majority of them actually are getting the appropriate next steps and getting diagnosed earlier and have curative intent. It's an awesome feeling to be part of.
Yeah, the numbers, as I was doing some research for this, the numbers were really staggering, and I found it really enlightening. It gave me some confidence and got me excited, which actually kind of brings me to my next question is why now currently, and you said 70% of incidental findings never get followed up, and it's not malicious, but what are the challenges within the healthcare system, or why aren't these being followed up on? And what is, I don't know, is something breaking within the system?
So if you look, I brought up the thing with, you're in a motor vehicle accident. So 60% or up to 60% of the patients who go to the emergency department, they actually don't have a PCP. And they're likely go there for another reason. And so when I go to the doctor 2 weeks after I've been in the emergency department, that's not front of mind, something that needs to have follow-up in 6 months from now or a year from now. And so a lot of this gets lost. It's like finding a needle in a haystack for a provider. Mm-hmm. And so, either they don't have somebody who can order the next step is one, and two is it's a needle in the haystack of all the data that the providers are getting.
Yeah, that totally makes sense. Shifting gears slightly, I saw that a hospital in Florida recently reported that 75% of their lung cancer patients or of the lung cancer was caught at the early stages using Eon Health. And what I found fascinating about this was that's like almost 3 times more than the national average. I'm curious why tools like Eon Health are not more widely adopted, and what headwinds, if any, or challenges do you face from clinician adoption?
Yeah, I mean, look, I thought back in 2015 that this thing would be adopted by every single health system ubiquitously across the board. And the reality of the market is that there's a lot of confusion, and there's a lot of competing priorities that seem like they're mission critical that hospitals can choose to try to attack. And so over the past 10 years, we've made tremendous momentum where there was only a few, select healthcare systems that were thinking about attacking this problem. And now what we've done is we've made it front of mind, where over the past 3 years, you've seen rapid adoption, not just from our solution, but even others that are attacking this problem. So now it's front of mind, and because of us, I mean, we were, been there for 10 years, and the snowball has finally gotten big enough to where it's moving downhill and it ain't stopping.
Yeah, definitely feels like there's a lot of momentum here, especially with the introduction of AI over the last couple of years. But what I think is interesting and is important for our audience is you guys were kind of on the forefront of AI before it was a thing, right? I would love to hear you kind of break down, what you guys are using in terms of what we're calling AI, and what's different from that, from Gen AI or these large language models that we're all thinking of that are kind of top of mind today.
What's really important to understand is that you have a high stakes clinical workflow here where errors could cost people's lives. And so, what I'm going to, you brought up this thing in one of your past podcasts about AI running a business and how it, ordered 1,000, toilet seats and tried to sell them. And it's a funny mistake, right? But at the end of the day, if a probabilistic engine like an LLM or even a frontier model, which is, guessing what the next word should be or what the output should be, makes a mistake, you can't not have a human validate that. And what you need is you need to have a deterministic model as well. And a deterministic model, Max, is something where I'm going to put in 1,000 of the same record of the same, data. And I put it through that model. It's going to have the same output no matter what. If I did that with an LLM, then what's going to happen is I'm going to have some variability in what the outputs are. So what we do is we combine the best of both worlds. Like both of these things have pros and cons in terms of the approach. So we combine that deterministic engine, which is rules-based, always the same. We combine that with an LLM and a probabilistic model. And when they agree, we can cross-check against the millions of records that we have already human validated. And in a high-stakes clinical workflow, we have the ability to actually achieve true automation of the workflow to execute against the result.
That sounds like it takes a lot of data in order to be able to say, yeah, this is something that needs to be checked on. I'm curious, like, how long did it take you guys to acquire or to generate all that data?
So we, for the first, 10 years of the business, did like kind of what everybody else is doing, right? We apply different types of AI models that have outputs that are always, validated or adjudicated by a human. So we have, like the hospitals don't have AI validators. They have clinicians, right? They have employees that are doing other things. They don't have people who can do that. So we created this services where we were en masse validating and adjudicating all the outputs of AI. And we created this massive data set over 10 years, which now I can create confidence of the output of AI and say, hey, look, when both AIs agree, right? Both AI models agree. I can go back to this huge data set and say, is the likelihood of it being right better than the validation errors of a human? So a human, when they validate, they make errors, right? They make errors too. And so the threshold was, I need to be better than a human validating this by 2 times for me to say I'm going to bypass that in a high stakes clinical workflow. So over 10 years now, we have that data set that we can cross check against to be able to truly automate.
Got it. Yeah. It takes time in this particular use case. It takes you that time to really validate your data, make sure the data works and is accurate. And then you can end up deploying it. So this wasn't like an overnight thing. And I think that's also kind of important when it comes down to the difference here, because I think a lot of people building AI today aren't always thinking about how much work needs to go into validating it, or they're just starting on that journey.
It's a huge thing that I think people don't get, right? So AI generative AI, I use it all the time. We use it, right? And okay, I'm going to use generative AI, and people are obsessed with the how powerful an algorithm is, how many parameters it is, like the new frontier models in terms of their performance and ability to reason or do multitasking. While that's great, that doesn't always translate to the performance of extracting out that specific abnormality that we're looking for and all of the things that are necessary to execute the workflow to get a patient and a provider to have the behavior of, hey, I'm going to actually follow up. And so what those generative AI models are doing today, and everybody's overhyping copilots and agents, right? But really what they're doing is that they're flagging abnormalities or extracting. And they're saying, hey, doctor, look at this. Or hey, nurse, or hey, coordinator, look at this. And they're creating this massive validation burden to people that are already burnt out. If they have to double check an AI output, that just shifts the bottleneck. And so the right question is not how powerful an algorithm is, it's how are you dealing with errors of that algorithm?
Yeah. And how are you correcting them and fixing that? Yeah. I'm curious. Another thing that you have said is that AI companies are solving problems that are not necessarily problems in healthcare. I'm curious, where do you think the industry is getting things right, and where is it getting it wrong right now?
Yeah, I think that, where they're getting it wrong. So I'll bring up, Pixel AI because it's on trend. Where hey, the CEO who said, "I'm going to replace radiologists with these AI tools." Right? Um, I don't think that there's an understanding of the problem that they're solving for. Radiologists do a great job at certain tasks, and they do it in a way that actually makes financial sense if you look at how long it takes them to do that specific task and how much it costs in terms of that transaction. And so then they'll build this expensive AI model that then replaces a non-expensive, low error rate, already in institutional flow. And I'm like, you're going to charge literally 20x the cost for this algorithm. Like, why would I buy that AI? Right.
Yeah. Yeah.
So, like, to me, that's an example of where you have this kind of misplaced, solution that doesn't really have a problem.
Right.
Where they're getting it right is in the actual kind of, I think, non-sexy places where it's, I have this human who is doing things that they shouldn't be doing in terms of their role or their license. And can I have AI actually replace that with high fidelity? And I
Yeah.
think that you've seen an increase in efficiency and overall cost to the healthcare system because of how AI has been deployed in those use cases.
Yeah, definitely. That's a good point you bring up there about AI's impact on the healthcare system. And this is maybe a broader question. I'm curious what your thoughts are about AI's impact on the healthcare system in the next year, maybe 5 years out.
Yeah, I mean, I think that right now the market's confused, and I got little kids, right? I
Yeah.
guess they're not as little anymore. They're 8 and 11, and my 11-year-old comes to me with all of this language that they use that I don't even know. They're like bussing and he's cooked and whatever. And if I were to use the words that my daughter's telling me, I'm going to use them incorrectly, and I don't know what the heck I'm talking about, right?
Yeah.
That's the analog for how healthcare folks are talking about AI. So I think that there's a level of education about AI that they're starting to break through that hasn't happened yet. And there's this feeling of AI obsolescence that's out there. Hey, look, man, these frontier models are going to do everything. And anybody else, any other type of AI doesn't, I'm so hesitant to invest in other types of, narrow AI or specific use cases that have been tailored. And so really there's been a little bit of a halt on healthcare actually investing in pilots or experiments that could be beneficial or even things that are proven that have value today. So there's a kind of like this pause where they're learning. The market's learning over the next year.
Yeah.
Right.
Yeah.
So like that's going to probably pass where they end up using the wrong type of AI or the wrong vendor, they fail. That cycle lasts about 12 to 24 months. And then after that, I think that they're going to get real smart quick. And at the same time, the AI is going to make tremendous progress. I mean, if you look at what the frontier models are progressing at a rate that's extremely fast.
Yeah.
And their ability to be able to take away a ton of the menial tasks that people are doing that they shouldn't be doing, and people's jobs are going to change dramatically. It's going to focus on the human workflow. The human workflow is going to be attacked. After the human workflow is attacked, then you're going to be able to get to the wow. And that's probably at least 5 years out. What is the wow to me? Man, I'll tell you, like automation and getting the human out of the loop, it's not as exciting to me. What's exciting is aggregating the data, organizing the data, putting AI over top of that data, and seeing if it can see signals that the best in the world that are humans can't see. That's wow.
Yeah. Yeah. I so agree with that. And I think we are going to continue to see things that are taking the human out of the loop. And that's not as exciting. That's kind of like table stakes for AI. But those bigger applications, and I think even what you guys are doing right now or started doing, more than 10 years ago is exactly that wow factor. And it goes beyond the table stakes. So you're looking at all that data. and you are trying to make sense of it in a way that the best in the world either aren't able to make sense of, or bringing up those insights front and center to people because they're too swamped and too busy to be able to notice everything, and especially in the healthcare system. On that note too, I'm curious if you have any thoughts on things like ChatGPT rolling out more health-focused features and how those can be helped with people. I myself, I'll just say I'm a little skeptical of it. I don't like the idea of giving my health information to an LLM, at least not at this stage. But I'm kind of curious if you have a take on that.
Yeah, I mean, look, I think that most doctors are using those models, and I think that a lot of patients are using those models, and I think that overall, from an educational standpoint, they're very useful.
Yeah.
Look, like there's two things that are like at risk now that people need to put, I think, a lot of value on. One is like sometimes it's better to have a PhD in what not to do, and then there's experiential wisdom and creativity that I think that the LLMs really miss. And so if you're a doctor and you're taking the outputs from that LLM when you're trying to do research or summarize something, and you can't identify hallucinations or when it's wrong, man, you could really fall into a trap that has like really, really bad consequences, right?
Yeah.
Now, if you approach it from a provider standpoint as something that's additive that you can then verify and you're safe in how you use it, it makes you better. It definitely makes you better. From a patient standpoint, look, like if it confuses you and adds fear, right, which it can do, that's a problem, right? There's cascades of care that, where, hey, I'm going to trigger an event, and then I'm going to communicate that to the patient that you have this thing, but the likelihood of it actually being that like catastrophic thing is very low, but the LLM lists that catastrophic thing. Man, patients get scared.
Yeah.
And what happens is the whole triage system could be, upended because you may not have anything that's really like serious, but the LLM scared you, and now you're taking a spot of somebody who actually needs to be seen. And the reality is there's more patients and less providers, so you could compound the bottleneck problem that exists already.
Yeah, I didn't even think about that, but it's such a good point because these LLMs, they're getting their information more or less from everything that's out on the internet. I remember, maybe 5 years ago, you'd go, "Oh, don't Google your head hurts because that might be something really bad. And you're gonna stress yourself out." But now, I think that the thing about AI is it can deliver things in such an authoritative, direct, or even persuasive way that you can really start to get into your head about it, maybe even more than you would if you were just reading something on WebMD.
It's a net positive though, Max. At the end of the day, it's a net positive for sure because like there's such high variability in the knowledge base of providers, and the knowledge content has expanded rapidly and continues to balloon. So how the hell can humans keep up with it? Like this is giving us a chance to keep up with it. It's just that if you really like understand all the pitfalls, I named a couple, then man, like, and you're supercharged. You're a supercharged provider. You're you're an advocate for yourself. And that didn't exist. That type of resource didn't exist before the LLMs are out there the way they are today and how they're going to be in the next coming years.
Yeah, I mean, that's a great point. And I'll share, I know someone who is a practicing physician as well. And one of the tools they have is, I think it's called like doximetry or something like that. It's a AI tool where they're able, it's like an LLM, it looks like, at least. I'm not allowed to use it, but I can see them use it, and check and see, like, patient is talking about XYZ symptom, what could it be? And it gives them information about what it could be. And it's at least a good jumping off point. And I think to your point, it's definitely a net positive because maybe it reminds them of something that they weren't thinking about in the moment.
The next step to me, and sorry about that, there's this real-time streaming of the data. So like I'm a patient, I get an exam done, and I automatically match to a clinical trial or something that's new that a doctor would never know about. And AI there, I think, has tremendous potential to match patients faster to treatments that most doctors wouldn't know existed.
For sure. Yeah.
In real time.
That is, I think, and I think those are the areas where people are going to really start to appreciate the technology, because I think we still have like I said, I'm skeptical about it from this health standpoint, but I think once you start to actually show those net positives that it's bringing to people, especially in healthcare, they're going to be more receptive to it and want to participate. And, might even be asking, oh, are you guys using AI? Because I want to see a physician, or have my healthcare provider using AI because I know what it could do as a positive.
I'd want my provider using AI.
Yeah. And I know mine does right now too. So I'm thankful with that. Cool. Well, Dr. Aki, I really appreciate your time. I think we can wrap up here. If there's anything else you have to share or plug or say before we close out.
Hey, do the right thing is all I'm going to say.
That's right.
Yeah.
Oh, great. Thank you so much for joining me today on Actually Intelligent.
Yeah, appreciate it, man. Thank you.